Okay, so thank you. We're live right now. So good evening, everyone. Thank you and welcome to the Finance and the Facilities and Finance Committee meeting. Today is October 19th, 18th. The time is 6:02 p.m. And we're here at Harding High School. And I just want to just say, I'm here acting chair today because Keisha Casimir, board member, is sick, and I just gotta ask you guys to keep her in your prayers because she went to the hospital today. Okay, so with that being said, and I'm sorry I said that because we were live, right? But anyway, I'm sorry. So with that being said, I want to start the meeting with the approval of the minutes. Can we approve the minutes? I want to welcome, no, I'm new at this, so give me a minute. I want to make sure that we all know that board member uh, Albert Benahan is with us. Um, Committee meeting Albert Benahan, and we have board members Joseph Sakalovich, Willie Medina, and Robert Traver with us as well, along with our acting superintendent, Dr. Avery, and Chief CFO Financial Officer Nestor. Thank you. And first order of business is approval of the minutes from last month. Second by me, Tahiba Bain. Minutes approval of the minutes from October 21st, 2004. Next, we're going to have a facilities update. By Mr. George Garcia. Yes.
Thank you. Dr. Bing, as for the privilege and for the record, I know me and you were part of this committee. I know the chair, Casimir, maybe to contact you to let you know, she cannot make it. But as for the record, if you could let him know, me and you, we was part of the committee. I just found out just now that tell us that the chair is not going to be here. It's good to have a communication. It's okay you run the meeting, but that's the same way part of this committee would like to know exactly, she's not going to make it, so we can know, we can be on the same page, please, for the record.
Okay, yes. So committee member was asking that he be aware that we be on the same page, and he make note that next time that everyone that's on this committee be told at the same time that the chair is not available for the meeting. Is that correct? Okay, great. And that's on the record. Okay, great. Thank you.
Good evening. So I have a very, very brief update on the facilities master plan this evening because I know Nestor's got a lot to go through with the budget. We're continuing on moving forward with the facilities master plan. Both the facilities assessment and the demographic study are continuing to move forward. Next month at the facilities committee meeting, we're going to have both vendors come in to give you guys an overview of exactly where we are in the process. That will be the beginning of us starting to merge both these studies together to create the facilities master plan. And that's all I have for this evening.
Thank you very much, Mr. Garcia. Is there any questions from the board committee members? Mr. Benaher? No? Any questions from the board? No? Okay, thank you. Thank you very much, Mr. Garcia. Okay, so next on the agenda is the presentation of the Bridgeport Public Schools fiscal year 24-25 financial condition report as of October 30th, 2024, and potential gap closing measures. And this will be presented by our CFO, Nestor. Thank you. Okay, so he was just passing. Thank you very much for that. You need me? Okay, he was just passing a summary of what he's going to be talking about to the board members over there that possibly that may not have what we have in front of us. So everybody could be on one page because this is about inclusivity. So great. You ready? Sure.
Okay. Good evening, everyone. My name is Nestor Nikor. I'm the Chief Financial Officer for Bridgeport School System. We've taken a review, a comprehensive analysis of July, August, September, October financial activities of the Bridgeport School System. Upon analysis, it was concluded based on data that the school system does have some financial issues, which I'm very much sure that most people were aware when the current year budget was adopted. In a nutshell, the current year budget was adopted with a $26 million one-time revenue, if you want to call it a gap, pretty much. So, and that's what it is. The budget was adopted with a one-time revenue assumption from the Internal Service Fund, which is a gap. And since the revenue is not going to be non-recurring, if this year elapses, that $26 million is going to be carried forward as a deficiency into next fiscal year. Then you compound the cost of living increase that will come into next fiscal year. So you have a compounded effect of 2 years negative numbers. So the assumption that the current year budget should be balanced with a $26 million one-time withdrawal of funds, which is basically one-time withdrawal of savings, reserve savings, which is non-replenishable, meaning that once you take it, it's like going into your bank account. Once you withdraw it, it doesn't multiply unless you put it back in. And that's where we are. So, but having gone through that, in my view, in my professional opinion, I don't think it's prudent, meaning I don't think it's financially wise to withdraw $26 million one time this year and create a burden, compounding burden going into next fiscal year. The fact of the matter is that we did receive a lot of money from the federal government for COVID. It's called ESSA money. And a lot of programs were implemented, a lot of things were achieved, psychological, mental, emotional, building maintenance, all those things were achieved with those COVID monies. Time has come now that those monies have been depleted. So we're going to have to revert back to our old level of living because those monies are not there anymore. And so my recommendation is that we don't withdraw the whole $26 million reserve. We will try to withdraw $14 million and go back to our old level when we had before we had the influx, meaning before we had the government giving us a lot of money, pretty much. So pretty much we're going to go back to our level, funding level, staffing level that we could afford when we didn't have the influx of money. And that is what's called deficit or gap closing measures. And that's what I'm going to be presenting to the board and to everyone tonight. Because if we proceed with one-time chunk or one-time lump sum withdrawal, we're just, excuse my language, we're just building a deeper hole for ourselves next year. Any questions relative to that?
Wait.
Sure.
Okay, so we're gonna have questions, but I just need to make an announcement to acknowledge board member Andrew, excuse me, Andre Woodson. Thank you. He's now entered into the meeting. He does not want to come up on stage, but he's in the building. Okay, so what's gonna happen is the committee members will ask the questions first, and then the non-committee members will have a chance to ask a couple of questions each, okay? So is there anything else that you?
So I'm gonna, through Madam Chair, I'm gonna clarify and sum up everything. Right now, we're looking at $38 million potential gap, but we're going to be getting credits from different grants to the tune of $6.5 million to reduce that gap. Then I'm proposing to withdraw or use for the district to use $14 million of the reserve money instead of 26. Then that's a reduction of the $38 million, part of the reduction of the $38 million deficit. Then I'm proposing that we revert back to pre-ESSA before ESSA monies, meaning we're going to have to downsize, reorganize, realign, consolidate positions in order to save $10.3 million in 6 months. In order to save, okay, we're going to try to save $6 million in reorganization and personnel when you include the fringe benefits and the health insurance attributable to it. But since we're in the middle of the year, in order to save $6 million, you're going to have to reduce $12 million in positions and fringes because you're already 6 months into the year. The effect of doing $12 million is that the $12 million will come into full effect next fiscal year. You're saving $6 million today, but what you really cut or what you really reduced or what you really realigned is $12 million. So that whole $12 million will come into full effect for 12 months of next fiscal year in order to try to stabilize things going forward. It's not a permanent solution. It doesn't fix all your problems, but we have to start somewhere. After that, we're going to look into other programs. Don't want to get too much into details. I already have the payroll department start looking at all the retirees to make sure, I don't want to get into too much details, but we have some internal auditing that we have to do to make sure that our house is in order, pretty much. Let me put it that way. I don't want to get into too much technical details and wear everybody out. At the end of that, we still have $7.8 million deficit to cover, but we're going to take it in stages. Let's try to get back to the ESSA level, then let's try to see what we can realign in order to close the rest of the gap this year. One thing I have to say here, the problem doesn't go away. And we have to find a permanent solution to our problem. And in my professional opinion, that permanent solution is to try to keep the district afloat financially for about 3 years at most. But in that interim, we have to reassess our schools, see which ones that are not really all that habitable, possibly consolidate and expand and build a brand new, rehabilitate a new school like we did Central High School, expand the special education program in-house, whereby we can bring some of our special ed students that we place out of district in-house in order to reduce cost. With special ed, what is driving this cost, so everybody will know, is the special ed cost. From 2020 to 2024, the cost of special education has gone up $24 million in 4 years. Gone up, not the total, gone up $24 million. We're placing our students out of district to different agencies. We don't have a choice. Whatever music they sing, that's what we're going to dance. Whatever price they quote, we have to provide special ed because it's state mandated. It's one of those mandates that the state of Connecticut gives every municipality. It's called unfunded mandates. They give you a mandate, you have to do this, but they don't give you the money to do it. But you have to do it by law. And guess who pays for it? Taxpayers at the end of the day. So we have to be creative by trying to bring that program in-house. We have to remodel a school as brand as new. The state will pay 78% of remodeling that school, if you remodel it as new, the key word is remodel it as new. The state will not give you money to repair a school. The state will not give you money to fix a school. You have to remodel it as new, as if you're building a brand new school. Then the state will pay 78% of the cost of building that school. Then the city will chip in the rest of the money. The city side of the budget will chip in the rest of the money. So for all practical purposes, it really doesn't cost the Board of Education anything. But you get a brand new school, expanded brand new school, bring most of these special ed students in-house. And that's how you save money on transportation. That's how you save money on out of placement, out of town. There are some students that you cannot, we might not have the capacity or the ability to handle based on their needs. Those students will still remain or still go to those specialty schools, but at least it's a limited number. Right now, we don't have a whole lot of choice, but just keep sending, and these agencies, we're at their mercy. So that's where we are, and to me, that will be the permanent solution to Bridgeport School District problems, bringing our special ed in-house and try to contain the cost because it's not going away. I'm pretty much, yes, I'm all set. Yeah.
Thank you. Thank you for that. Lester, questions from the committee members? Any questions, Mr. Benningham? Not at this moment? Okay, great. Well, I do have a question.
Sure.
One of my questions is, I heard you say that in order for, we need to reassess schools, and that's in the district already for rehab.
Yep.
To bring them as new. And if we do that, and the key word is to say, to make it as new, not a new school, not to fix, not to repair, but to rehab as new. And I just, for clarifications, 78% of the cost will come from the state.
That's correct.
And then the other costs will come from the city.
That's correct.
Okay, great. And it wouldn't cost the Board of Education any money.
That is correct.
Okay. Now, my question to that is was any of this school that you're talking about, could that be in one of the school closings that was talked about in the earlier this year during the session, earlier this year?
Okay. The schools that to be closed was before my time, before I joined the Board of Education. They're already doing feasibility studies on all these schools to know how much or how bad they are. There's no need throwing good money on bad money, if you want to put it that way. If a school is so bad and so down that it needs total restructuring and total rehab, and it doesn't have enough space for you to expand. First of all, the state is not going to provide money for fixing a school.
Right.
So the city is not going to give you $50 million to fix a school. The city only gets in when the state is paying chunk of the money. So we have to do reassessment of all the schools and see which ones need less work. Whereby if you're expanding them, there are a lot of things to be put into consideration here. Your goal is to find the one that doesn't need a whole complete revamp of foundation being gutted and the beams being resupported. You got to find one that's strategically located to accommodate multi-district or multi-areas of residents. You have to find one with enough land where you can spread your wings by expanding to accommodate these special ed students. So we are now talking about, first of all, thinking of going to buy land to build another school with the price of houses today. I mean, I don't know, most of you know, a 3-family house, depending on the neighborhood, is $500,000 in Bridgeport, and you're going to need a lot of them to build a new school. So first, you got to go through eminent domain. Now you'll get caught up in legalities of the eminent domain. So the best thing is to utilize what you have already. We own it, we own the title. We just have to make sure it has enough space. If need be, you can do eminent domain on 3, 4 houses to expand yourself. It's not going to be too outrageous. But going for a brand new school in a brand new neighborhood and try to do eminent domain, the price is outrageous. First of all, the state of Connecticut will not give you a dime for land acquisition for a new school. So everybody will understand that. They only get into what you already own. They're not going to give you a penny for land acquisition. The state will not. They will only help you with rehabilitating. They'd rather have you build a new school, but a way of getting around it is to say you're building it as new. The key word is new, but it has to be new. You just don't say it as new and think you can get away with it. It has to be new. They have to review the design. They have to review the whole infrastructure, just like Central. Just like Central was done. Central was gutted out and retrofitted, and it's like a new school actually. They kind of use the old shell.
Okay, great. Thank you. Okay. Thank you for that. I appreciate the clarification on that. One other question. I heard you mention that special ed is the top cost
It is
of one
of the deficit.
of the deficit.
Mhm.
And you're saying that so it goes hand in hand. Okay, I'm just doing this for me because I need clarity.
Mhm.
Like if we were to do the rehab of a school to make it as new, and then make it a special ed building for special ed to reclaim our students
Right.
out of the district back into our district, that can cut and will cut costs.
Absolutely. You have control of your destiny. Yes.
And right now, because we don't do that, the people that service us out of district, we are, did you say unfunded mandated?
Well, it's a mandate. The state requires that
Right.
once a child has some issues or whatever the case might be, or has some criteria, they're considered special ed. In some cases, if the child is not paying attention or a little bit hyper, if they do what they call IEP, testing of the child and distraction, law, you have to have an adult next to the child in class. It's called one-to-one para coverage.
Okay.
And it's not cheap.
Okay. So that's another high end.
That's another.
Okay, great. And before I move on, that's my last question for now. I want to acknowledge Board Chair Christine Baptiste online, present with us in this committee meeting. Thank you for joining us, Madam Chair. Albert Benahan, any more, and you have any questions at this time? Yes? Okay. Wait, hold on. That's you. Listen. What, Benahan, there you go. Do it again, Benahan. There you go. You all set.
Thank you, Dr. Bain. Mr. Nestor, I know you were talking about the budget, but my question for you is for the special need. Do we have something, or we have a list, or do you receive information that they suing us from the special education?
No, I'm not. Madam Chair.
Press the button again. I'm sorry.
Yeah.
Madam Chair.
Hold on, let me get red.
Which one? Okay.
Because I don't see. Okay, there you go. Do it again. There you go. Nope.
Okay. I'm not aware of any legal suits against the district.
Nothing. Okay.
Not that I'm aware of. No.
If it's we have something, that they're gonna sue,
So legal. Okay.
from the special.
Oh, for
education.
special ed. Okay.
Yeah. So I just want to be sure, and it's nothing, for the record, because I don't want later.
Surprise. I'm sorry. No. What I'm saying is when the state gives you a mandate, you have to comply by it. As far as I know, Bridgeport is complying by every state mandate relative to special ed.
Okay, so I just want to ask you a question to your question. Is that okay?
Yeah, go ahead.
Okay, so are you asking if we were to do that, will there be?
There's
any-
nothing in the record. We
Right.
don't want surprise later. Listen, they sue us on special education, something like that,
Oh,
because
if we were
that
to
is
rehab
actually-
and bring the people
I
back?
don't want surprise later. That's
Okay,
why.
great. So just for clarification, because we need clarity, his question was like, if we were to rehab to as new and bring our students back, will there be any legal ramifications? And the answer is no, because we are in compliance now,
Oh.
and that would be in compliance then. Is that correct?
Yes.
That's okay. Good.
That is correct. I mean,
Okay, great.
the reason why we have a contract with them, we're providing our we're sending our students to them. It's as good as any school. If you choose to send your child to a private school, any day you cannot afford it, you withdraw the child at the end of the semester. It's as simple as that.
Okay, great. Thank you, Mr. Mr. Benahan. Now, Albert Traber? Yes. I don't know. I don't see you. Make who? No.
Like,
Is it exact?
Get 15.
There you go.
There you go.
Um,
Exact one. He was the exact one.
Thank you, Dr. Bain.
You're welcome.
On your packet list, the letter states effective immediately, freeze all district managed operational accounts and payroll hiring except essential and mandated expenses. And what you're referring to is, and you mentioned in your presentation, Mr. Nakwo, was trying to get us back to pre-COVID spending levels. Do we have at this time a list of what expenditures that would affect, i.e. programs and staff?
to Madam Chair, let me clarify my wordings. I said bring the staffing back to pre-ESSER funding level, not again, when I say funding level, I mean as far as head counts. I don't mean dollar-wise. You cannot bring staffing back to pre-ESSER funding level, meaning salary, because these employees, some of them, most of them, are entitled to their union wage increases. You cannot reverse their salaries. It's all, maybe most of the positions that were added and funded through ESSER extra funding.
Let me be clear, Mr. Nakwo. I understand salary levels have risen, but I'm referring to positions. What positions have been added since then? What positions would need to be eliminated since then? We have added, and we have been having this discussion since long before you came aboard. I get that, about adding positions that we're going to need to eliminate when ESSER expires. And so I'm wondering if you've begun to compile a list of what positions will need to be eliminated, positions that need to be eliminated because they are positions that we've added since ESSER came aboard and came online, since we got ESSER. And now that ESSER's gone, we can't afford those positions. And that would also apply to certain programs and funding that we will no longer be able to continue those programs. So I'm just wondering if you've begun to develop a list of what positions and programs we can no longer afford to pay for, given that we no longer have the funding for those positions and programs.
Okay.
Madam Chair.
Yes, please.
I can at least attempt to kind of answer your question. We have, as of last week, we have a preliminary list of the possible positions that we need to consider. One of the things that I'm working with Nestor on is really kind of fine tuning the list and to be able to bring to the full board for our next appointed meeting, which I think is the 25th, to be able to have a deeper conversation on the whole reorganization piece. We've talked extensively about starting at the top and working our way down to avoid the classroom perspective. And so that's going to be important for us to kind of, and we're going to have to dig deep to be able to bring all of those up in order to kind of make sure, but we're not doing any of that until the full board is able to kind of look at that and guide us as to how far we need to go down to make those cuts.
And you read my mind, because of course that's where I'm getting to,
Yes, sir.
is that it's the classroom that we have to worry the most about. And it was the central office positions that we objected to the strongest as we
Yes,
went
sir.
through the past year, that why put positions on that we know we're going to have to cut in a year when ESSER expires. And, you know, we went through this obviously in the past painfully, even in the classroom, but we certainly don't want to have to go through this unnecessarily again in
Absolutely.
the classroom. And so that's what we're anticipating, and not happily, obviously, for any of us. But that's what we need to start looking at. And so
Absolutely.
it's next week's board meeting that I'm concerned about, because I didn't hear it tonight, that when we get to next week's board meeting, we're going to need to see some meat on these bones, that we
Absolutely.
can start to see what the real impact is, not the
And
theoretical.
I think what we're going to try to do the next couple of days is to fine tune, you know, that list in order to give you a dollar amount that we feel is going to be able to be reached. Again, that will fluctuate a little bit, but I think the hard conversation is to where do we start? And I can tell the board, I'll be having my individual conversations with you guys over the next, you know, couple of days. We're gonna, you know, we can share a little bit of that with you individually, but as a full board, you'll have a comprehensive list of things that we need to consider to bring forth to you in order for you to kind of give us the guidance that is needed.
And as you know, because you've seen some of it too, we made a decision to table one item last week in light of the memo that went out the Friday before, because it involved $100,000, and that amount of money may become important with regard to whatever ends up on that list.
Mhm.
And so we need to start seeing what that list might entail to know relative at next week's meeting, because we would like to pass that item, but we need to see in light of what else
Absolutely.
might be on the chopping block that we need to look at. And it's not a happy picture that we're all confronting, but it's a necessary picture that we need to look at and
agree.
start looking at immediately. And we all know that. But we need to be able to look at the harsh reality
Absolutely.
of what's coming at us.
And
the
I
next
think
year.
that's important, and even for the community to know that, you know, I think a lot of decisions we could have done, you know, at an earlier stage, but we're here. And I think one of the things that, you know, I know my administration have been, you know, again, the last couple of days really looking at is that where do we go? Where do we start? And we know as a leadership team, it's going to start with us. And as the acting superintendent, I'm going to have very diligent, you know, conversations with the team to help guide that decision, to have something in front of you by Monday, in order for you to be able to kind of guide. Again, in order to reorganize this district, the Board of Trustees is going to have to give full authority to administration to be able to do it. But with a clear path and some very concrete, evidence of what needs to happen, I'm hoping that you guys will give us a clear path to make it happen in a meaningful way. Because like you said, when you have the lives of individuals in front of you to make decisions, we have to do that in a way that's going to be, helpful for everybody, but maybe painful for everybody. But I think if we do this together with the support of the board, I think we're going to be able to, again, you said you were here before. I wasn't here when you had to make those decisions, but I know they were hard decisions.
I was on the union side at that time,
Okay.
and we were suffering the consequences of the chops.
Mhm.
I know Mr. Sokolovic went through the board side of some of those cuts, and so it's a very difficult time. I would like to say one other thing. I have been involved. I've discussed with Mr. Woodson and some of my colleagues that there are also efforts to try and get some of those unfunded mandates funded, like special ed. A number of us were involved in a meeting last week with Board of Ed representatives all over the state. And on Friday and Saturday, we were at the CABE conference, most of us, uh, Chairperson Bain, and the rest of us were there, and it came up frequently, special ed in particular, about the need to get the state to more fully fund special ed needs because it is a cost to all boards of ed throughout the state that needs more funding. And with the $4.4 billion surplus the state has, there is much talk about the state's need to come up with more money and more resources. So we are fighting that fight too, to try and get additional monies allocated to the districts. So we are already working on that end too.
Madam Chair, I think one of the things that we're doing as well is trying to make sure that we can mobilize, community members, teachers, administrators, staff to go up and advocate as well. So I think that's important, that we're ready to mobilize and engage. I got the communications department working on a few things to kind of spur that initiative out to be able to get more people involved as well. So wonderful.
Okay.
If I may.
You wanted to say something?
Yeah. If I may add.
Christine, after you speak, I'm going
Okay.
to bring Christine
If
up.
I may add to what Superintendent, if I may add to what Dr. Avery had said, just to let the board know, the board members know, this reorganization or budget balancing act is going to be done in 3 tiers. I don't know of anybody who can tell you they're going to come in one day, come up with all the solutions how to balance budgets. That person is fooling you. So it's going to be done. It's going to be done in 3 tiers. You do the first phase, you digest it, then see where you did not capture everything. You go back and refine it. So the first stage is review all the teachers and all the teachers and teachers on special assignment. They're called teachers on special assignment. Basically, if you really have special assignment, we really have to understand what that special assignment is. If it doesn't correlate to productivity or it doesn't relate very well, you're going back to the classroom as a teacher. There are some positions, some teachers, they're given a special assignment to run some programs, okay? In that case, if the program is not going to be there, you're going back to the classroom to teach. I mean, that's teachers on special assignment. And after that, we go through all that, see if we can consolidate some classes, okay? If you have a class that's 14 or 15, you might want to, try to consolidate classes to a reasonable number, but not overstocking the pond. That's how you try to contain your costs as far as, bringing teachers on. After that, then you're going to do a reassignment of employees based on need in different areas in order to plug all the holes or all the shortfalls. That's the second phase of it. After that, then you go into the third phase, what I consider to be the third phase. After you've done all the realignment and everything, that's when you go and say, all these positions were not funded by ESSER. We put everybody into place where we strictly, definitely need them. All these positions were funded by ESSER, and the funding is not there. You just have to let people know that the funding is not there and we cannot afford it. That's pretty much it. Then the fourth phase is the big and lengthy phase, which is looking at the feasibility study of all the buildings, seeing which buildings need too much money to fix, and seeing which buildings need not a whole lot of money to fix, but have enough land that we can rebuild or rehabilitate as new in order to bring the special ed program in-house. The beauty of it is when you build a new school or remodel a new school as new, it brings about some parents would love their kids to go to that school. Let's just be real. If you remodel a school as brand new school, the parents wouldn't mind bringing the kids to go to that school anyway because they're proud of the environment. That's the factor. It's all a simple psychology in human beings. And the kids would like to be in that environment, I think. So that's the last phase. But the bottom line to it all is that it will reduce the cost of special ed by bringing it in-house. Every other thing that goes around with it, goes along with it, it's all gravy. It's all gravies. But the bottom line is we want to contain and maintain our financial condition by controlling our destiny, or financial destiny, if you want to put it that way.
Thank you. I'm going to bring it to Christine and then to Joe Sokolovic. Christine, you had your hand up?
Yeah, I think it may be useful to have an updated capacity versus utilization for all the buildings. Also, I think it'll be helpful for the board to have in front of it the classrooms. I don't believe so. I think it's going to be important for each building. We need to know the student to teacher ratio. I recall, and this is in past years on the board, you know, we had classrooms in one school where the student to teacher ratio is 1 to 13. And so it's also going to be helpful for the board to have what is the ideal number of students in the classroom where the teachers are actually earning their income. So that information is in front of us because we all know the union contract is for 29 students. And those are going to be critical. And then I know this was part of the presentation from last year with the building our own special education site. And I was wondering if Dr. Avery, if you could just give some more information to the public, especially during this meeting regarding FAPE and the least restrictive environment and why bringing students back in-house. We would be able to accommodate some, and I know Nestor touched on it, but being that special education is your background, that you could share that more publicly in terms of savings. Thank you.
Thank you, Madam Chair.
Madam Chair, I think for clarity, that some of the documents that the chair asked for are going to be disclosed when we get the demographic study and the facility study in the upcoming months. That detailed information is being gathered right now, and I think it's important that we give the third-party agencies the opportunity to do that. There's some of that information that there was a request by a board member for some of that information that staff is working on. We should have it in the next day or so, and it'll go out to the entire board to make sure that we give, so whenever something's requested, we'll make sure we give it out to everyone. But those reports they're being kind of finalized right now. That is critical information that each of you will need for decision-making moving forward. And we're going to make sure that it's clear that information is going to be provided to the community. We have several community meetings already and potentially scheduled right now that we're going to take that information on the road. I think the community needs to be really attuned to the things and the factual information that's going to be released from that, and we'll work from there. So those are coming. We'll get that information to you as quickly as we can when the time presents itself.
Is it pressed? Did you press?
Yeah, you gotta put it back up.
Okay. You good? Wait. There you go.
Thank you, Dr. Bain. A couple of things. Just a quick yes or no. We're talking about 24, 25 gap closing measures right now, right? Correct?
That is correct.
We're not even into the 25, 26 issues.
That is correct.
And this year's current operating budget is $309 million for the already approved, pending the gap measures.
Yep.
25, 26 operating budget, if nothing changes, and adding $13 million in escalated costs, so we would need $324 million to operate, which would bring us to like a $50 million shortfall before accounting for any increased funds.
That is
Is that
correct.
right?
That is,
Approximately correct?
that is correct.
All right, thank you. So now, you mentioned a lot about cuts to pre-COVID and ESSER funding and the like. And you mentioned doing the tiers, looking for teachers on assignment. I don't believe we should be looking anywhere at pre-COVID levels of staffing before we get administration back to those pre-COVID levels of funding, because we will not be able to sell to our community. I've been out there, I've been knocking on doors for the last few months. I've been in these community groups, engaging with the community, which is a piece of the budget we missed the last go round due to the late budgets and whatever have you. I'm not gonna try to live in the past, but it's actually a foundation for the future, so we don't repeat those same mistakes going forward that were made before. We definitely got to have community buy-in. The community will not buy into anything we do until they fully trust us. And speaking of trust, Dr. Avery, you mentioned, it's not a knock on you, but you mentioned full autonomy to do what you needed to do. That's what we did with the last budget, which compounded the issues. We just listened to what administrative staff had to say for the most part. I'm speaking as a board, some of us didn't vote yes, some of us didn't vote yes. But the thing was, let the professionals do what they know how to do. We basically just did that. Now, some of those concerns could be alleviated in the following manner. You mentioned that you will prepare for us administrators that you think need to be accessed. But I would like to see a list of basically every single position side by side, pre-COVID, post-COVID, with a salary next to it, and whether represented or not represented. Because I don't know how familiar Mr. Unquo is with bargaining unit contracts. We don't see all those savings right away. You access a director at $160,000, $170,000. You're not getting that whole savings in the first year. What's going to happen is they got the union rights to bump a principal from the position. So you're only saving the spread in that initial period between the director and the principal salary, which then that principal, if that principal's excess, got the right to bump downward, so on and so forth until you get to the position of teacher. And something I think we need to come up with a hierarchy of priorities, and first, last, and you don't touch one priority until you finish the first bucket. Like for instance, sacrosanct should be core academics. We are a Board of Education, core academics are at our core. We're always about how our test scores aren't rising, our test scores aren't rising. We need to do that. And I think a second bucket should probably be the support staff around the students. Anybody who's looking at a student and providing direct to student services should be the very, very last on the chopping block. Now, this is not to say every single position is important. Like I said, I'm probably the only one sitting at this table who has made cuts to education, who has voted for cuts, and had to look people in the eye as I told them, I'm sorry, the job is no longer necessary. But all jobs are necessary. All jobs are needed. If we were sitting in a town like Greenwich, if we were sitting in Trumbull or whatever, we wouldn't be having these conversations. All these positions are valuable positions to some extent. We're at a position in our work right now where it's no longer about what's best for our students. It's what can we take away from our students that will hurt them the least. And we need to be mindful of that in every single decision. I know I'm preaching, I'm sorry, but we are going into a season where we're going to be lobbied like we've never been lobbied before in our lives. You think the hard part's over after going through what we just went through on the administrative side? It's gonna get worse, and it's gonna tug at your heartstrings. It's gonna hurt you. Every decision we make going forward is going to hurt children and education in some way, shape, or form. So we got to balance the hurt. What hurts the least? What can we take away that's going to do the least amount of damage to our children and to our city? And so that's why I think we need to get that. And I had a suggestion. I don't know if you looked at this. I don't see it on the plan for this year, but our a la carte services.
What you want?
What's that?
Our a la carte services. I mean,
What's that?
we for instance, I'm going to use an example, not particularly picking on this one, but because it's been there before. We contract out for some communications work to get our message out. I don't think at this point in time it'll be a valuable service to our students to advertise in other districts. Like I did a little research. We got to add in Las Vegas about how we sent students to UB. I don't think that's a necessity right now. Yeah, we want to brand the district, but I mean, and so it's, and the like services like that. Any a la carte that doesn't directly affect the classroom, I think we really should consider holding back spending on those. And also contracts. We need to look at some of the contracts, which ones are no longer serving us. See if we got exit clauses and escape clauses for all of them. And I got a lot more to say, but it's gonna be a long conversation.
Yeah, I know. That's not
It's gonna be,
unusual.
this is right. And I would just like to caution the board, because I have been through this before.
I think what you're saying is great, and you have some great ideas, and the viewpoints that you have is spot on. So I just want to acknowledge that, okay?
Thank you.
But we got other people, so.
Right, yeah, but that's to my final point. We cannot rush this process.
Right.
We cannot be in a hurry to go home. When the city council, they got a budget that's about double ours, and we take about half of that. They spend hours upon hours upon hours discussing the finance. Last budget cycle, we cannot make the same mistake and try to get home quickly and leave everything in everybody else's lap. Because the bottom line is, we are empowered by the state to pass, adopt, change this budget. This budget we own. And it would behoove the administration to make sure they know that, to protect themselves as well, because it's our decision. We reflect the values of the community. They respect that. They reflect the education. Yes, they have autonomy to some point, but we need to recognize with this budget, we are the ultimate authority. It is our responsibility. If they say we want to cut out every paraprofessional again, that's saying you want to cut out every paraprofessional again because you allowed it to happen. Budget is ours. When we go out to the voters, they're not going to buy that. I'm just going to use your name for example. Dr. Avery said we're doing this. No, we own that decision. We got to take responsibility. We got to start stepping up as a board,
Right.
and do what we were elected.
Well,
to do.
I'm glad you said that, because at the CABE meeting, that was stated, like the responsibility of the administration is to present the budget, and then it's their budget, right? But when we, as the board, then in turn adopt the budget and say, yes, we say yes to this budget, it becomes our budget. So you're absolutely correct on that. So I thank you for that. Absolutely. And no, it's not no, we don't need to rush this, because our students deserve more than rushing, but we just need to, like, when, I just hope moving forward, and I'm gonna say this now, so when we go into next meeting, moving forward, just let's try to keep focus and keep on task of what we're here to do moving forward, because I'm gonna bring that back to you, Joseph, just to let you know, right now, we're on record, okay? I'm gonna get them. All right. All right, yes, thank you for that, Joe. I want to bring it to board member Andre Woodson. He's at the podium. There you go. Wait, you gotta press it. There we go. Thank you. Nope, do it again. There we go.
I hate to be the bearer of bad news in the room, but I just had to let everybody know that there was a superintendent that was preparing for all of this that you guys are talking about. You know, she was a couple of months in advance, and people might have not liked her approach about it, but she was preparing us for this. All the steps that Mr. Inquo spoke about taking, she had those steps on paper. But you guys chose to get rid of her and take responsibility for yourself. Now you deal with the community.
Thank you for your thoughts and your
Wow.
words of feelings and heartfelt, Mr. Woodson. We're not going to talk about that because that's not what we're here to talk about. So let's move on. Any other questions concerning, you have any more? Do you want to, okay, Albert Benahan, thank you. Let me turn my mic. I'm sorry. I just- There you go.
Something actions, people can see what's going on. So, thank you, Dr. Bain. Mr. Nestor, when I see the budget, the 100% over here, and please help me with this, it's very different, the numbers we have here. So I just want to, our package. All this number is very different for this number, it's in the package. I just ask you because I see numbers different and that make me scared. I don't want things something update. And when we see this package, that the number's very
When
different.
do you receive this back?
This come in the package, for us, for our meeting. Maybe they can, Dr. Avery, they can send it to you so you can see it and follow, because if you see the numbers is different, and I don't want surprise later. That's my concern. So Dr. Avery will send you that. The other thing for the record, I know we talk about cuts and stuff like that. This gentleman was here. Yep. Oh, no, he went outside. Mr. George Garcia, his facility.
Okay. I apologize. Can you give me what you're talking about over there so we can be on one page? Far as the,
This is in our package, Dr. Bain.
it's where?
It's in the package, in our thing.
Okay, give me 1 second, let me.
So
Okay,
this-
go ahead, continue, Mark.
1 second.
Yeah, all that. So maybe Dr. Avery, if you can send that.
Oh, no. Through Madam Chair, if I may,
Yes, go ahead, you may.
what is looking at is the proposed budget that the board adopted. What I provided is the July, August, September, October monthly financial report, which is the projection. So there are two different things.
Okay.
Look, the budget, I'm updating the committee or the board based on the budget they adopted and the projected year end. This is where you're gonna end. So it's not, the projected number is not gonna tie with the budget that the committee or the board adopted in their budget process. There are two different documents. Yeah.
Does that answer your question, Mr. Benahan?
Not really, but I'm going, well, we talk about this about later because it's gonna be, Mr. Nestor, sorry. I know you received that. The only thing I would say for the clarify for the record that I see, the numbers very different. I don't want surprise later. And I
Okay.
also was talking about facility. I know we talk about cuts, but I want to be sure for the record, Mr. George Garcia and the team, they do a lot of things for Bridgeport Public School. And I don't want to hurt later. And I'm saying this for the record to be sure of, starting now, that I don't want cuts is the department. When we need more help is in the department, because these people having short staff, they do a lot of things for 37 school, especially when it's winters come, they're all ready. So I just want to be sure that for the record. I know sometimes we talk about any change, and I know we talked about something a few minutes ago about some change to the school, all that stuff. It's fine, but I want to be sure this for the record because I don't want the same problem we have a month before. When anything change we have for any schools, any update or anything, is we have to be sure, and for the record, that the staff, students, and parent committee, they know what's going on in each school. I don't want surprise later. I don't want the staff, I don't want the parents, I don't want the student, no community to get crazy, get upset, get mad, and get nervous. I want to be sure that for the records to be sure, we be on top of that. We can do things, we can change things, but without the parents and staff and students and community, I'm not going to move forward. Just want to be sure for the record. And I know, Mr. Nestor, you said that sometimes you will show the budget, we have to fight and everything, but I know that we have to, together we can make the difference if we have to go to Hartford, because this is the best thing for the students, staff, parents, and community. We're not going to give up this for the children. This is not for the gay title or who got power. I'm tired about that. This is here for one reason. We all here for our students, for Bridgeport Public Schools. And people say, oh, I don't need to deal with parents. Guess what? Yes, we have to deal with parents. Because without parents, no kids, no education. And we are not going to be here because the parents is the one decide and let us to be a board member. If they trust us, we work for them. They don't work for me. I work for them. We work for them, like it or not. So I just want to put that for the record. Thank you, Dr. Bay. No more questions, no more comments.
You're welcome. Thank you, Mr. Bennett, and Board Chair, for your thoughts. I'm going to go to Christine and then I'll come to you. Christine, Madam Chair, you have the floor.
Yeah, I apologize. I lost service, so I wasn't able to completely hear Dr. Avery's response. But no, Superintendent Pryor, whether interim, has not provided the capacity versus utilization information. So that's something that the board shouldn't have to wait for the demographic study to come out with. That's something that's normally produced. That was produced by Mr. Chestani, that was produced by Ms. Perrin, that was produced by Dr. Levy David. So I would expect that information to be given to the full board, and not to necessarily hold out and wait for the demographic study, because that won't be available till about February. So we shouldn't be waiting 2 months on that information. Thank you.
Thank you. Thank you, Madam Chair.
I could address them more.
Did you understand what she said? Okay, Madam, did you? Oh, yeah.
If there's problems hearing me, I'll just send it via email to the full board, but that information is always given to us. So that's not an issue or something to wait for the demographic study.
Oh, you're talking about the demographic study. Okay, give me 1 second.
Madam Chair. The district does have a few crystal reports that we can provide the full board, and those reports I can make sure that we get out to you first thing in the morning. I will make sure data management will get that keyed up for you guys, and you should be able to get those reports on a weekly basis, daily basis. I'm not for sure how often they go, but sure, Madam Chair, we'll get those out. Those are already reports that already go to district campus principals already, and district staff, so we can loop you guys in them, so your inbox will be full of reports that we get on a daily basis, from attendance to utilizations from the campuses. I understand now that the CRIS report that she's referring to, we have access to those, and we'll make sure we get those out, Madam Chair.
Thank you. Thank you, Dr. Avery. Is there anything else?
Yeah,
Yes, okay.
For Madam Chair, I just want to make the board members know that certain actions have to be taken, and they have to be taken boldly in order to bring finances back in line. Also, to remind or let every board member know, the Bridgeport school system is not allowed to run a deficit at the end of the year. So everybody will know that. And if we don't take any actions to bring things in line this year and balance the budget, the problem is going to compound into next year. And when it compounds to that level, somebody else is going to have to come to do it for the Bridgeport school system, which is the state of Connecticut, which is what they call the Financial Review Board. I don't think anybody wants that.
Just for clarification, thank you, Nestor, for that. Because that was going to be my next question. What happens if we can't get our finances in order? And you just answered that. So the answer that I heard is that if we do not, we can't run into a deficit at the end of this year. And if we do not get our finances in order or aligned by the end of this year?
Even if you manage to withdraw all your savings and close this gap this year, you basically created a bigger hole or compounded the effect for next year that is way beyond manageable. You basically out there saying the state, come and take me, come and help me. I can't get my house in order. That's basically what it means.
Right, and then that would mean someone else would come in. I'm gonna get you, Mr. Medina, Board Medina, okay. Someone else, meaning the state, would send someone to take over our finances.
The review board, their review board.
Their review board. Okay, great. Thank you for that clarification. Mr. Medina, give me 1 second.
Whatever, 15, yeah, one. Yeah, thank you, guys. Thank you for allowing me. What is the balance right now of our ISF fund?
Through Madam Chair, it's $34 million,
It's 34 right now?
$34.4 million, yep.
Thank you. We'll cover that again. I just wanted to get that number. And I just wanted to add, because I'm seeing the numbers here, some of the numbers that you guys don't see, the public, the cost of things that are adopted into our budget. We have that right now in front of us. We also have what we have expended up to date. We have those papers now in front of us. And also there's a forecast that is standing in front of us for the 24-25 general operation budget, meaning forecast, meaning what are we expected to spend in the path that we're taking right now, in the course that we are right now. And this is why we're having this meeting. I would just want the public to know what's in front of us now that we didn't have in our packet. Just because this is why, to my colleagues and those that are not here and those that have left, and Madam Chair, this is why it was important back in April when this was presented that we needed to sit down as a board to look, to make sure that we can make any added savings because of this whole ESSER fund that we are trying to now navigate through. And this is why it was important for us to sit down as a board. And I know you and I are new to the board in the last year, but in everything that I've done in the last 6-7 years in education and every single budget, this was presented, this was worked on with the board. And this is why we needed time to learn about this, because we're talking about right now $5 million of over forecast. We're talking another $18 million of over forecast. We're talking another 3.3 million of over forecast. We're talking about another line with 11.8 million of over forecast, and we could have defended that a little bit. We're gonna see very shortly how big we are ahead on top. That way we can see how it's in, because again, we just finished telling a program that has to do with our children, that they're affecting them right now emotionally. Again, we just traumatized our kids that we had to say no to $100,000 to a program that's been elevating those programs that they take hands on. And at a fraction of the dollar, we had to say no because we needed to learn about what we're sitting down here to get today. And I thank everyone that's presented today, and I thank everyone that's talked bravely, but this is why we needed this months ago. This is something that was forecast many months ago, but it was never presented to us before. This was in the hands of the people months ago, but yet it's being given to us now. You and I, you as chair today, and us as a board member on our side, this was given to us now. And again, our chair is not on right now, but this is the stuff that we've been asking for months and months and months. That way we can get ahead of this game and work as a unit. So I thank you, Nestor, for taking the time. There are going to be some other hard questions, but this should have been given to us months ago. And as our CFO, we expect that we can now sit down at the table more often. That way we can help you, help us, help the district.
Especially now we have a CFO that's actually in district. How about that? Okay. All right. So wait, Mr. Traber, I see you, but I want to get to the online. I see there's one, and then I'm gonna come back and play and bounce off. Andre Woodson, you're gonna get the floor, and then you're next, Mr. Traber. Andre Woodson, you there? Okay. So, Mr. Traber.
Thank you, Madam Chair. Mr. Naquo, we don't have 34 in the ISF. We budgeted to use a significant portion of that in this budget. So I think we need to clarify here. We had 34 before we passed the budget. The budget that was passed, I'm looking at the documents you gave us.
Mhm.
And I remember the discussions that we had.
Mhm.
We initially were hoping to only take 8 million out of that. But when we didn't get the 16 million or 17 million from the city,
Mhm.
we had to take another 12 million out of that to
Mhm.
balance our budget, 12 or 13 million, 12.8, I think it was. So I think you're misspeaking when you say we have 4 million in the ISF. We really drained our ISF to balance this year's budget. We had hoped to save a significant portion of that ISF to have a much larger percentage of it. My recollection is in the neighborhood of 15 million to use next year. But I think that it's not correct to say that we have 34 million
Okay.
in the ISF.
Okay.
You may be hoping, and I understand that, sir, to have a larger percentage of that to use next year to balance the budget, as we were this past spring when we were debating how to put the budget together. But the budget that we eventually passed relied on a much larger percentage of that. So you may now be asking us to come back together and reconsider that. And I understand that, and I might not even disagree with you about trying to do that. But I think we need to make sure that we're all talking on the same page as to what we passed and what you're now asking us to think about doing in the interest of being more fiscally prudent. And so I just think we have to be talking in the same language as we enter this difficult discussion. And we do not have 34 million in the ISF based on the budget that we passed last spring.
Madam Chairman, I could address that. When I started initially at the beginning, I made it very clear that the board adopted current year budget using $26 million of internal service fund. I made it very clear. That, however, I don't think it's financially prudent to use or take $26 million out of current year budget. That I'm proposing $14 million instead of the 26 that the board adopted. That's what I said. I made it very clear at the beginning. So I don't see where I have misspoken. I don't see where I have misguided anyone. I made it very clear and gave a prudent financial recommendation. The board member asked me, how much do we have today in internal service fund? What we have today is $34.4 million. What we're going to do with it is a different question. What we have today untapped is $34.4 million. Whether we use it or not, that was not his question. So I don't see where I've misrepresented any fact at all.
I did not say misrepresent, Mr. Quo. Let's be very clear. I said misspoke. And misrepresent would be it would be an inappropriate word for me to use with you. I respect your professional integrity. So I would not ever say that to you. But what I did say was misspoke because we did pass a budget that allocated, like you just said, 26 million. And at the beginning of your presentation, sir, quite frankly, I have a hard time, and I am a professional educator. But when you throw out too many numbers at once, it's impossible for me to follow them all. So you laid out numbers that I need to, I've had this discussion at these meetings before. I'm a tactile learner. I need to see the numbers on paper in order to follow however many numbers you put out. So I couldn't follow all the numbers. So when Mr. Medina asked you in the end, none of us followed how much money is in the ISF now. So you may have said that, and I would not argue with you that you said that at the beginning, but you had too many numbers at the beginning. I was trying to take notes, and I couldn't keep up with your presentation. It was just too many numbers at once for me to follow all of them. So one of the things that I was going to ask is that I would hope that at next week's board meeting, we have that in writing so that we can follow along with your presentation, because clearly there was a lot for us to digest. And I couldn't get it all down. And you tried to give us the overall sheets, but the numbers you were giving us were not on the sheets per se. So we couldn't follow it. So I respectfully believe that you said all that at the beginning, but I didn't get it. So I wanted to be clear that in answering Mr. Medina's question, that we had 34 million, it is, to my understanding, no more, because we passed a budget to use most of that last spring. So, that didn't make sense to me. And so as a layperson, not as as an accountant like you, or as a numbers man like you, I need to see that and understand it better. And with the exception perhaps of Mr. Sokolovic here, most of us are not numbers people like you. So we need to see it a little more clearly.
Madam Chairman, I don't
Yes.
want to keep
Okay.
going back.
Yeah. Mhm.
I did a presentation in the Finance Committee strictly on the availability or available internal service fund.
You did.
It was well detailed. Handout we're given. I showed the ins and outs and how we ended up that we had $34.4 million. You were in that meeting, everybody asked a question. Everybody knew that as of June 30th, 2024, we had $34.4 million internal service fund. How we use it, what we do with it, how we allocate it is a different topic. With all due respect, board member, what was your intent, Trevor? Board member Trevor, what was your intent or what was your answer you were expecting when you asked that question? Were you looking for the reduced internal service fund, or you were looking for what is available today and what we do with it? After all, it's not your problem.
Well, Mr. Medina asked you that question. And
Mr. Medina.
we thought, given the budget that was expressed.
Okay, hold on. Call to order. Okay, so what I will say is that, I think he was asking Mr. Medina, what was
Mr. Medina, yes.
what was it, the reduced or what we have on hand now? We're not gonna go into the weeds on this, guys. I just want to let you know that. We're gonna, this is going to the next full board meeting. We just wanted to give a synopsis and an overview and an update of what's happening now in the finances. And I think we have a robust conversation going on, but we still need to be at task. Medina would like to, board member Medina want to answer that question, but then I'm gonna go to Andre Woodson, and then you have one more question, Mr. Sokolovic, and then, that's it. Oh, you have one too? And then Benahan, and then no more. Yeah. Oh, I didn't get you? You should be good. Wait. Yep. No. Let me turn me off. Give me a sec. Push the button. What is this? Oh, there you go, executive 2. There you go.
Thank you. Yes, to answer your question specifically, I asked because I was wondering exactly your thought is where are we with the ISF fund to figure out what was it that was already used. And by you giving me that number of 34.4, it gave me the understanding that we have not used anything from there. And like you said, and like my colleague said, there was a lot of numbers in the beginning, and I wrote it down now what you just said about the 26, the 14 that you're trying to bring it to 4, and it was hard even then to try to write down. So I just wrote it down now. So I thank you for those numbers. And again, it was perfect laid out because we have not used that yet. And it's good for us to be clear on that. That way, I appreciate you. And like Mr. Traver said, we respect you, and we know that now we have a collaborative thing that we can work together because again, we want you to help us, help you, help us for the kids. So thank you very much.
Thank you. Andre Woodson, I'm calling you again. I see that, if you have any questions, please present yourself.
Yes, I do.
Thank
With
you.
no questions, just a comment. You know,
Okay.
I appreciate the board members' concern about our being fiscally responsible and stuff like that. But like I said before, this is all stuff that we knew months ago. I don't want the administration, Dr. Avery, Mr. Inquo, to feel like this is all their responsibility. The finances of the board and stuff like that are not totally their responsibility. They're not responsible for what the money had, what money was spent, what money is left. So they shouldn't be asking the guys questions to where they're making it seem like people are guilty of stuff. He gave you a detailed explanation of what the money is and why it is what it is. They don't need the third degree, asking them questions. These are professional people. They've been doing this a long time, a lot longer than some of you been out of high school. So you should give these people a break and show a little grace to these people. Don't working for us and doing the best job that they can. Thank you.
Thank you, on member Woodson. Um, I just want to say that, we are trying to come out of a hole, right? We're trying to work together to come out of a hole that was not created in the last couple of years. It was a deficit way before any one of us that's sitting on this table, well, here, has gotten here, right? Has come here. So you're absolutely right. We all need grace, and they need grace to try to figure out ways, solution, and methodologies to come up with a solution for us to come out of a deficit in stages. No, it's not going to happen in one meeting. It's not going to happen in one sitting. It's not going to happen overnight. It's not going to happen in a year. But if we move and we take advice from the experts, right, I think that we collectively can and will come up out of this. Thank you so very much, Mr. Woodson, for saying that. But I want everyone to know that that's what we're here trying to do today, right? And yes, and to what you said earlier, Mr. Woodson, yes, this is something that Superintendent Carmelo Levy-David was trying to implement. Absolutely. However, it didn't work out, and it's unfortunate, and I'm saddened about it. Yes, but we're here now. So now that we're here, we as a collective and as a community have to come up together, right? And I want to just acknowledge everyone's feeling in the space, everyone in the space, and what everyone perceptions are in this space. So thank you, Mr. Woodson. I'm going to go to Joe, then I'm going to go to Albert. I'm going to go back to you, No, you can't. There's only two. So Joe is next, and then Albert, and then that's it. So thank you, Mr. Woodson. I can't come back to you. Go ahead, Joe.
Yeah. I agree. I actually agree with Mr. Woodson for a change. I agree totally with what he said. We cannot hold Dr. Avery and Mr. Unquo responsible for the past, but we as a board are responsible for what happened in the past, and we as a board are responsible for holding them responsible in the future and going forward. I just want to start with that now to my question. Mr. Unquo, a little bit of clarity for Mr. Medina's question. He basically asked about the balance. I think what he's trying to get at is if we put in all these ESSER reductions and all of that as of today, seeing as the year has already started, I'm sure we haven't expended any of the ISF yet. We haven't made a withdrawal yet until we go into the, so the entire ISF is sitting there, but some of it is encumbered. Do you have a ballpark figure of what would be encumbered if we stopped everything right now?
Through Madam Chair, the Internal Service Fund has not been encumbered. You cannot encumber something you don't know what you need.
Right.
You actually withdraw Internal Service Fund through journal entry, what they call journal entry, audit entry, towards the last ending of the fiscal year, which is June of 2025. So you have all this freeway, all this time to find solutions or try to find solutions to reduce the financial hemorrhaging in the district and try to bring things in line. So to answer your question, there's no encumbrance or
Projection.
the internal service fund has not been obligated. It will be obligated if we don't do anything.
Correct.
Right now, there is opportunity to try to redeem the situation or tap into the bank reserve that we have, if you want to put it that way, to a minimal level and not go and scoop the whole bottom of the bank account. I personally, I don't believe in blaming people or trying to say, it's not my turn, I didn't do it. To me, that's non-productive. Whatever happened, happened. We are here. We have to fix it. If the house was clean, I wouldn't have been called to sweep it.
All right. And,
Well, all right.
right, one further point, basically more of an accounting thing that's nagging at me. We've been deficit spending for the last X amount of years by using our internal service fund. So to be more precise, we're not allowed to go into debt.
Right. Okay, so
You're actually using your reserve of
To cover,
surplus
to cover the deficit.
to cover the deficit, but you cannot run a
Absolutely.
deficit.
Right, I understand that. But this year, we're in no jeopardy of going outside the law and spending more money than we have and running afoul of that. But not that it's the responsible thing to do, just to bring it back to clarity.
I don't. To bring it to clarity, again, I'm going to tell everybody, let everybody know what the consequences are. You can empty the coffers of the internal service fund. You're just creating a $40 million hole next year. How are you going to close it? You're basically opening the doors and giving the state the master key.
okay. Thank you so very much for that. I appreciate you, Joseph, Chair, Joseph Kolovich. Yes, Albert Benahan, you're next. Let me turn on your mic. There you go.
Thank you, Dr. Bain. I want to be sure this for the clear. Mr. Nestor, when you came here, of course, this is not your fault. Because this is what happened when things not ready, done months before. I know when Ms. Eagle was here, in the beginning of January 2024, she will start working with the budget. And we all know that this budget's behind. I know you come, but trying to fix the mess, let's put it this way. And I know you try to do the best. Nobody's telling you like it's your fault, and I know you be like, oh my God, this is like a soup, and you're trying to pull everything organized. But this is what happened when things is not update, it's not on time, it's not communication, stuff like that, because we try to do the best we can do to work with this budget. As I said, and I always said this at the beginning, this is what happened when things is not done. Right now, to this Monday, I know what I'm gonna do Friday. I don't like to things have behind and wait for somebody. So this is the reason, that thing is not update. It's not, everybody go crazy. What's going on with the budget and cut and everything. And one thing I'm gonna say for the record for finish, very respectful. Before they do cuts, I don't want them trying to do cuts for the people like custodian, security, cafeteria, all these people, they work very, very hard. I just want to push show for the record because we're going to do cuts. Let's go for the people from the top, from the people that make very good. And this is very respectful because everybody know we're going through a lot of crazy stuff with the budget. We don't want to do cuts. We don't get laid off for nobody. But if we're going to do lay off, let's go for the people on the top, not the people that work very hard. Like I say, and they take care of students the way it's supposed to be in the parents. I want to be shared that for the record. Thank you, Dr. Bain. No more comments and questions.
Thank you. Thank you so very much. Personal privilege.
Congratulations on a great job as chair.
Thank you. Thank you, Mr. Traber. Okay, so yes, so before we go, we have to move to bring this to the full board on November 25th. I'm gonna make a motion. Albert Benahan.
It's a plan.
Oh, then we don't have to do that?
It's a plan, yeah. It's a plan.
Oh, okay, never mind. Okay, so that's what happened when you're new. Okay, so you're filling in, right? Acting chair, hello. Well, anyway, all right, so listen, as long as I'm up here, I'm gonna try to make everybody laugh because, you know, I'd rather laugh than cry or cuss or something. I did that before too, but anyway, I want to move to adjourn.
No.
Wait, hold on one
Listen,
moment.
When, I thought there is a lease that needs to be, oh, shoot. The city attorney, I think the city attorney had asked Danielle to put it on the agenda, kind of an addendum, the lease agreement between St. Peter,
No.
okay, all right, that's fine. It could be it could go on
It
Monday.
go- yeah.
It's not a big, no, it's not a problem. It could go
Okay,
on Monday.
good,
Yeah,
because
it's
I would
fine.
have to deny
We-
that.
We finally reached an agreement with the parish attorney. So
St. Peter.
all the legal jargons have been corrected with our city. So I'm comfortable. The city attorney is more than comfortable. So
Okay, well, we thank you for the update and we'll probably more than likely have it
yeah,
on Monday.
Monday, yeah.
Full
yep,
meeting.
yep.
Okay, so a meeting to, a motion to adjourn. So second. Thank you, guys.
Thank you.